Hello everyone, welcome back to FunDERMentals with Dr. Adobe Obasi. I'm a physician scientist board certified in dermatology and dermatopathology. In this video, we're going to discuss 7 deadly sins of hair care. So in the previous video, I had discussed the 7 deadly sins of skincare regimens. And so today I want to delve into 7 common mistakes that patients make when dealing with their hair. You may notice some similarities with my discussion on the 7 deadly sins of skincare because frankly, the skin and the hair are made of similar proteins, specifically the protein called keratin, although there are different types of keratins that make the hair versus those that make the skin and the nails. So you'll notice some similarities. The 7 deadly sins of hair care practices include ignoring the importance of nutrition and diet and hydration in your hair health, using the wrong shampoo, as well as frequency of hair washing for your specific hair type, ignoring any medical conditions that you may have that need treatment, because early treatment is most ideal when you're dealing with hair loss. And so ignoring signs of unhealthy hair that can lead to hair loss is one of the classic mistakes I see patients make. Remember that with every day that passes, you may be losing valuable hair follicles that can regrow the hair. Aggressive hairstyling practices using harsh chemicals, bleach, dyes, as well as excessive heat to manipulate the hair. And in the same vein, using high tension hairstyles that can stress the scalp out over time and result in hair loss. Having a high inflammatory diet, and then finally having a high stress lifestyle. Please check out my stress and hair loss video. So the first deadly sin is ignoring the importance of nutrition and hydration in your hair care health. What you put into your body can determine what building block you give your hair follicles where the hair grows from to make good quality hair. So you want to make hair that is resilient, as well as have a scalp that is not inflamed, that is healthy, so that that hair can continue to grow and undergo a normal hair cycle for your hair. It's important to drink enough water for the day, for your health and well-being, to cleanse the system, cleanse the body, and keep your tissues healthy, including your scalp where your hair growing follicles are located, so you can make good quality hair. The next deadly sin, which is having a highly inflammatory diet, I should say, it's very important because inflammation can cause tissue damage all over the body. And you've heard me mention this in a lot of my videos because it's a very critical theme for good health, which includes your skin health and your hair health. The skin and the hair, the scalp, they're all tissues that can be adversely affected by inflammation in the same or similar fashion that inflammation can damage the kidneys, the liver, the heart, your blood vessels, your brain. So it's important to cut down on triggers of inflammation, especially as it relates to your diet, because you can, for the most part, control what you ingest or what you eat or drink. Cut down on high sugar, high carb, high processed foods. That's a start to cutting down on excessive inflammation in your diet. And then what you ingest also plays a role. It's important to supplement your diet with multivitamins and minerals, usually in a combination, versus taking lots of individual vitamins that can just task your liver and your kidney to detoxify. So just minimize your risk by taking the good quality multivitamin and mineral, not necessarily the hair, skin, and nails specifically, just a good multivitamin and mineral blend that is comprehensive and can fill in the gaps that your nutrition is not affording you. Another deadly sin is having a high stress lifestyle. High stress results in a release of stress hormones chronically, and that can cause your tissues to change to be less effective. This high stress effect on the tissue can now cause changes on the skin and the internal organs as well as your hair that may not be desirable. Please check out my video on the role of stress in hair loss. There are some common conditions that are directly associated with stress, causing them to manifest and progress. But there, in general, everything that goes wrong with the body can be worsened by stress. So stress usually doesn't cause anything specifically with the hair loss conditions, but it can make it worse. It can cause it to progress. It can make it manifest when before it was under control. It can make it flare. The next deadly sin is not treating medical conditions early. It's important to know that with each day that passes when you have a hair loss condition, what we call an alopecia, you may be losing valuable hair follicles. So it's important to consult your dermatologist, treat hair loss conditions early so that you can get your hair to a more healthy state and enjoy your hair. As I mentioned in the previous video, hair loss can be temporary or permanent. Permanent hair loss tend to be scarring. Temporary hair loss conditions tend to be non-scarring. Alopecia refers to a broad term meaning hair loss. It can be because your hair is not growing properly. Your hair is growing but it's not ideal, so it breaks easily, or you have practices that break your hair when you're styling your hair. It could be that the scalp is inflamed and not making good quality hair. And it finally can mean that the hair is shedding as it grows, which is a normal part of the hair cycle as I described before, but certain conditions can accelerate the shedding process and cause hair loss. So I want to reiterate that nutrition plays a big role in your hair health. Cutting down on stress plays a big role in your hair health. And these two factors can affect different types of hair loss conditions, making them worsen or get better if they're mitigated. Inflammation can result in different conditions on the scalp that can affect the hair health and cause hair loss. So it could be inflammation as simple as seborrheic dermatitis, which is a type of dandruff that gets inflamed, worsens with weather change. It's common in patients that have sensitive skin genetics, like the eczema patients tend to manifest this condition easily. Inflammation can also be from systemic inflammation conditions such as lupus or systemic lupus, which can manifest on the scalp and cause hair loss, and a skin-only lupus that can affect the hair growth by scarring the scalp, called discoid lupus. Psoriasis can also affect the scalp and cause hair loss. Different medications can cause the hair to accelerate the shedding. Stressful conditions can now alter the normal balance of the hair and push the hair cycle where hair sheds more than normal. There are lots of conditions that can affect the scalp, so it's important to treat all of these conditions early by seeing a dermatologist familiar with treating your type of hair and getting treatments early. Another deadly sin is excessive tension and manipulation of the hair. In my video on stress and hair loss, I described a condition called trichotillomania, where patients, because of stress and anxiety, can manipulate their hair often. Sometimes they eat it and they cause a plug in their intestine called a bezoar. But most of the time, patients just pluck out their hair. This condition can lead to hair loss in those patients. But a more common practice is just using high tension styles, whether it's buns, braids, cornrows, attachments to the hair, whether it's weaves or other types of hair extensions, or even sometimes tight wigs that are ill-fitting, or using aggressive chemicals to lay them, and can now, when it gets removed, take along good quality hair with it. So there are lots of ways that we currently have that can be causing damage to the hair follicle as well as to the hair itself, with the hairstyles that are being sought after. So consult with your stylist as well as a dermatologist. It's a great team approach when it comes to maximizing your hair health. A stylist can be very helpful in helping you maintain your hair health by guiding you on products to use based on what they know about your hair on a more frequent basis than your dermatologist would, because the dermatologist will see you every few weeks to months, but a stylist, most patients go more frequently. They can also pick up on patches of hair loss you may not be aware is there, as well as in some cases skin cancers or growths of patches or spots on the scalp that you may not be aware of. So we've had barbers and stylists be very helpful in helping patients navigate their scalp and point out things that may not be healthy for them, and those have been very helpful in dermatologists finding and treating skin cancers, hair loss conditions, and a variety of other things that patients may find undesirable. So it's a great team approach. If you're a stylist, leave a comment below. I want to say a great thank you because you do help us in dermatology help patients. I hope you found the contents of this video helpful. Please share with your friends, family, colleagues, and acquaintances. And drop a comment below if you have any questions or if you have future topics you want me to discuss. You're all fundamentally awesome. I hope you have a wonderful day and God bless.